right, everybody, welcome back to another episode of Honestly Bilal. I'm your host, Bilal Ahmed, the fourth-year medical student from the University of Toledo, who you know now pretty well. Today, I'm actually joined with Dr. David Wu, who is an assistant professor of ophthalmology at Johns Hopkins Wilmer Eye Institute. I actually got to know Dr. Wu through my first guest from the show, Dr. Ravi Parikh, the medical retina specialist in New York. So through him, I got to email Dr. Wu, and Dr. Wu agreed to come on the show today or tonight, and here we are today. So he actually got his medical degree from the University of Michigan, where he stayed on and got his PhD as well, and then stayed on for residency in ophthalmology at the Kellogg Eye Center before flying to the West Coast and doing his fellowship in vitreoretinal surgery at the University of Southern California Keck School of Medicine. So then from there, he went to Harvard Medical School and taught ophthalmology and specifically retinal surgery, where he has an expertise in complex retinal detachment. And he, from there, went to Johns Hopkins, where he is now. And it's a pleasure to welcome you, Dr. Wu. Thanks for joining me tonight.
Well, thank you very much for having me on your podcast, I guess.
Podcast, video channel.
Podcast, video channel, whatever.
All three, yeah. Whatever, all the above is what I'll call it. All the above is the next title for the next series. But yeah, it's great to have you, and I'm really looking forward to your perspectives tonight.
Sure.
Yeah. So starting off, you're my first guest who is unique in two ways. Number one, you're the first guest I've had who has an MD PhD. And number two, you're my first guest who's actually you're specialized in vitreoretinal surgery, which is not the same thing as medical retina. So for those people who don't know, medical retina is a specialization, and so is vitreoretinal surgery, both retinal disease, but different specializations of how to treat different problems. So starting off, talk about what led you to get a PhD, and that's pretty unique. So why did you want to spend the extra time in school?
Yeah, so the PhD came about because I think I got interested in the eye when I was an undergrad. You know, a lot of us undergrads were trying to figure out what we're going to do. Mm-hmm. You know, I had a medical bent, so I wanted to do some research. And the laboratory that had an opening was an eye laboratory, actually. Okay. So I wanted to study the brain. The brain labs were all closed, but this retina lab had an opening, and sure. So I pretty much got hooked once I started in it. And I've pretty much always been doing research in retina since. Mm-hmm. And so I guess, you know, between your second and third years of medical school, some people will go off and do a PhD. And I enjoyed research enough that I decided to do that.
Right. Yeah, my roommate here, he's also pursuing his MD PhD. So he's in his second PhD year now. And just the scale of differences, not in terms of work ethic, but in terms of the workload, it's still a heavy degree of mental, effort, but it's just a very different pace and a different sort of skill set that's required, but it's still as taxing. And it seems like it seems like you have to use different parts of your faculties in terms of thinking and your creativity at least. And so it's been interesting to watch him and talk with him at night about it and how he goes about his day. So I'm sure you agree as well.
It's a completely different pace than medicine, and that's, for those of us that love research, I would say it was a great opportunity. It was some of the best years of my life. So
sure. So from there, you went into ophthalmology. So you went from thinking about neuro-related stuff to still staying neuro-related with the retina, which is nervous tissue, but then you actually focused more on ophthalmology, and then you went from ophthalmology into vitreoretinal surgery. So what led you to decide that vitreoretinal surgery is the field for you? And talk about vitreoretinal surgery and what differentiates it from medical retina.
Right. So, the eye, especially, you're probably appreciating this more since you're going to go into ophthalmology. The eye is actually a pretty complicated little organ, even though it's very small. There's all these different parts. Sure. And, we all get subspecialized in the different parts. And so I think because I did a lot of retinal research, when I thought of the eye, I always thought of the retina. Mm-hmm. That's one. And number two, the retina's, as you'll see, if you haven't already, the retina is a very beautiful part of the eye. Pictures are very beautiful. It has a very important function, actually detecting the light. So I think it's a lot of people that probably gravitate towards the retina for those reasons. And then one thing that draws a lot of us to the eye and ophthalmology is that there are a lot of neat microsurgeries that you can do. And retina has I'm very biased, but it has, I think, some of the coolest microsurgeries there are. And, I think if if you look in the first time on a retinal microsurgery, and it's one of the best views of the retina you'll ever have, and it's so beautiful, and you see all these tiny advanced instruments, and you get excited, at least that's what happened to me, then that's what's for you, I guess. So
Yeah,
that's what happened to me.
got it. And so, you actually also, you're in academia, and part of you're something that has been said in your profile, and something that people talk about, is that you're a great teacher of retinal surgery. So how difficult is it to try to teach somebody, one of your learners, retinal surgery, and how do you maintain your patience? How do you maintain your diligence, but also, with the complications that can happen, how do you maintain that sort of composure in an OR in those settings for retinal detachment or something serious like that?
Right. So, those of us in academic medicine, we're always balancing those two responsibilities. So you definitely have a responsibility to your patient first and foremost,
Right.
right? You've agreed to take care of them, so you have to make sure nothing goes wrong.
Sure.
But at the same time, if you never do anything else, you only take care of your patients. I mean, if we all do that,
Yeah.
then and none of us teach, then at some of us, we're all going to die off, and then no one's going to know how to do this.
Right.
So it is a balance, and some of us, I think, just love teaching. I mean, that's one of my that's one of the best parts of my job, actually, is
Right.
getting to teach residents and fellows, and sharing with them, I think, some of the kind of the excitement and the joy that I had when I first saw retina surgery for the first time, and try to get them interested, so that eventually, when I get old, that some of them will be able to take over and do what I do. So um, it's certainly not an easy job, and you
Right.
have to be very careful, and very patient, and you have to, above anything else, you've got to be the guardian for the patient. But as long as you can do that,
Mhm.
if you can show the trainee kind of how things are done, I think that's good for all of us. That's good for society. I mean, we're going to need retina surgeons in the future. So um, yeah, so that's some of us really love teaching. I guess I'm one of them. So
Right. Yeah. You just have that passion, and it comes natural, I guess. I feel like it's a calling in a way. I'm sure that's how you kind of see it as too.
mhm,
Right. So,
absolutely.
do you have mentors who kind of guided you to become a teacher, who kind of influenced you that maybe I want to do this someday for us, to give back as well?
Yeah, absolutely. I think I was very fortunate, both in the lab and in the clinic. Yeah, I had great mentors in eye research and in ophthalmology that, um, I guess, I do love what I do in terms of teaching, but also some of it is a kind of paying it back to them, or paying it forward. I don't know what the right expression
Yeah.
is, but
Absolutely.
to they were great teachers to me.
Sure.
You know, all those people at Michigan, and then
Mhm.
I've had great mentors at Los Angeles, and then even when you become faculty, there's always older faculty that
Right.
have lots of wisdom that you can learn from,
Sure.
and every time I'm trying to teach one of my trainees, I remember how patient they were with me, and I try to I try to pass it on. So
Yeah, yeah, absolutely. I mean, that's the kind of inspiration I think we all want to have and want to give back to, because otherwise it's a cycle. It moves on, and like you said earlier, if someone gives it up, then what if it doesn't go to the next generation? So, going from there, talking about the next generation, the idea of this channel and these podcasts is based for my generation, and after, for medical students more specifically, for that niche audience. So for anyone who's out there, including myself, I've had doubts. I've questioned myself. I've wondered if I'm doing things right, or if I have what it takes, or if I will, what if I stumble, and if I fall, and I have fallen, I have stumbled. And I'm wondering, from where you are now, with the perspective you have, faculty at Johns Hopkins and been faculty at Harvard, and doing vitreoretinal surgery, did you ever, in your training at these really top institutions at Michigan and USC, did you ever doubt yourself? Did you ever feel like there's like an instance where you're like, I just don't know if I have the skill set? And if you did have that instance, how did you overcome it?
yeah, so I would say, if you're medical training is a very long process, as I'm sure
Mhm.
you're almost done with medical school, which is already a large accomplishment. And then now you're going to, go to internship and residency and then potentially fellowship. And even after that, um, when you become an attending, these are, not, it's not a linear, progression for a lot of us. Maybe for some of us it is, but for me it certainly wasn't. I certainly had my highs where I thought like I was on top of the world, and then very quickly, even now, even with retina surgery, you can be brought down very quickly, and there are days where you wonder whether like maybe I shouldn't be doing this. This isn't going right, but you've just gotta, if you love what you do,
Mhm.
and you really want to do it, um, and you remember that you had mentors who believed you could do it, so they put you in this situation, then you just you look, if you need help, you ask for help.
Mhm.
That's very important. We're all gonna need help at some point,
Right.
and not just when you're a student or a resident, but sometimes even when you're a fellow or attending, you're gonna need help.
Mhm.
And so you ask for help, and then you know when someone's there to give you the help, you soak it all up, and try to pay it forward the
Yeah.
next time, I guess. that's
Absolutely.
that's it's a cycle. It's a never ending cycle of learning and improving. I think that's one of the great things about retina surgery, and probably medicine in general.
Right. I think that I guess it's like the humility that stays with you is kind of what guides you in a way too.
Yes.
So,
Yes.
going from there, I feel like you definitely have a passion for vitreoretinal surgery and retina and research and teaching. But what excites you about, going forward in your career? What are things that you're looking to really look into these days, or something that you're working on that you're really excited about that you want to share with us?
Yeah, I mean I think I have a great job.
Mhm.
There's aspects about each aspect of my job that I look forward to, and every day, just seeing patients, right? First and foremost, I'm a physician, right? So you know just getting to do retina surgery, fix retinal detachments, save people's vision. That's always something to look forward to,
Yeah.
and I look forward to doing that hopefully for a long time. Teaching, teaching people like Dr. Parikh, and
Mhm.
um, I'm not too old, but I'm not so young either.
Uh,
So I do have a small but growing number of trainees who are going on to do great things, and
right.
I always look forward to seeing what they're going to do next, and
Yeah.
seeing kind of what my current fellows are going to do. And
Mhm.
I look forward to watching them grow. And then in the lab, I think we have some exciting stuff going. There are eye diseases that don't have any treatments, and
Right.
patients come in with those diseases, and they're kind of frustrated, and they say there's nothing for me. And it's kind of exciting. I can say, actually, we're working on something on these mice, or
Yeah.
whatever, that these tissue cultures, or whatever, that might have an answer for you
Mhm.
in a few years. And it's certainly much more exciting in that regard now than it was a few years ago when I was a resident.
Mhm.
Science advances very fast. So I think yeah, I think ophthalmology is a great field to be in. There's lots to be excited about. The future, as one of my mentors says, the future is very bright
Yeah.
in ophthalmology. So people like you. So I look forward to seeing what's going to happen to you.
Oh yeah, no pressure now. I mean, I'm gonna take that.
No
Now I'm
pressure.
gonna run away and close my laptop, but no, but that's it's good to know that people invest in the generation next, and I feel like that's the cycle that keeps going like we talked about. And going from there, I'm wondering what your perspective is watching my generation and seeing what are the challenges that you think that we are facing and that we face ahead of us that you think that we should know about, and what are some things that you have in terms of advice for us too going forward with the ophthalmology match, or just in anything in general, and that we should know in terms of pearls for training and whatnot.
Sure. So I think we're in the middle of a crazy pandemic right now. That's probably the first challenge for your generation is, everything's different, right? You guys aren't even going to interview. You aren't going to physically visit any of these places that you're interviewing at, and I mean, I'm going to be interviewing fellow candidates soon, and
Mm,
it's going to be interesting to
sure.
try to make an impression on Zoom and to see,
Yeah.
kind of what impression they make.
Right.
So that's the first thing,
Mhm.
right? But there's a lot of the pandemic probably accelerated this, but it's changing, I think, medical economics and how medicine is practiced. And so I think things that have been taken for granted for so many years are going to be different for your generation,
Sure.
right? Even the concept, telemedicine is catching on much faster now than it was 6 months ago.
Yeah. Yeah. Absolutely.
Many more of my colleagues are using it. I've used it some, and that we wouldn't have thought it would have happened 6 months ago. So you guys are going to be, pushing forward some things that we haven't thought of. But at the same time, some principles stay the same. If you want to be a good ophthalmologist, a good physician, a good student,
Yeah.
you study hard and
Right.
learn everything you can, and
Mhm.
take every opportunity you have. My fellows, you know, didn't get to operate as much the last 6 months because the pandemic
Yeah.
slowed things down, right? That's
Yeah.
been the case at many institutions, not just ours. And so I think it just tells you even more you you should make the most of every opportunity you have, because
Yeah.
you don't know what's going to come next. And I think if you have that attitude, no matter what happens, you should be able to do pretty well.
Right. Well, that's good. I think we all have to learn how to adapt at times, whether there's a pandemic or not. So I think this will teach all of us going forward that when remember the days that we didn't know this was coming and how do we adjust after it. So hopefully we all learn from, in history. We look back at this and see it as a learning moment too, as tragic as it's been. Dr. Wu, just want to finish up. Those are pretty heavy subjects, but what are some things you like to do for fun? Some of your hobbies, interests. What's fun to do around Baltimore? I gotta know. I've never been to Baltimore. I don't know what it's like.
Holy
What do you
smokes.
do?
I don't have that much time for fun these days.
Oh, that's enlightening. Good. Good to
But
know.
yeah, if you want to have your time sucked away, it's not the ophthalmology or your career, it's having kids. So
Oh, good to know. Okay, there.
I I
Yeah, I forgot
I
to list that in
spend
profile, right?
yeah, I spend most of my time chasing my kids, most of my free time chasing my kids these days. But there's lots of around here. There's lots of museums,
Mhm.
lots of cultural stuff in the Baltimore, D.C. area. Lots of natural beauty, lots of good crabs to
Sure.
eat. So
Good. Good.
there's lots of good stuff. There's
All right.
lots of good
That's
stuff.
convincing. Yeah, you
So
sound like a travel guide.
yeah, yeah,
That's,
yeah.
yeah, well,
So
hopefully, I get a chance to come to Baltimore and maybe meet you in person or something.
yeah,
And it's been an
I
honor.
guess not. I guess not this year, right? But
Not this year. Yeah, I don't know.
yeah,
Maybe, yeah, maybe in the future. Maybe I'll do. Someone mentioned to me a hologram someday. That was a student I talked to later. Said hologram is the future. So you never know. That's probably where we're gonna be at next. So
yeah.
Zoom to hologram.
But
But anyways, Dr. Wu, thanks for joining me. I mean, it's been a huge honor for me to talk to you. You've been gracious enough. I know I shot a bunch of emails to you back and forth and trying to schedule this, but you were more than adaptable for my situation and just kind of trying to get this going. And I hope you look back on this recording and enjoy it. And to the audience out there, I hope you enjoy this interview with Dr. Wu. Like, comment, subscribe, honestly, Bilal, and spread the word. This is a channel for students, and it's always going to be for medical students. So I hope you guys enjoy this, and I hope we can build a community from here. So I'll see you next time.
yeah, thanks for having me on. And this is just an example. We certainly didn't have this when I was a medical student. So you're blazing the path for the next generation, I guess.
Hopefully so. Hopefully that's the plan. All right, Dr. Ruth, take care.
Take care.